Alright folks, in today's segment we're going to be doing the simple interrupted suture, which is the most common suture that you'll do in a clinical setting. It's good for many applications, so let's get started. So I generally start with the first suture in the very center of the laceration or incision. So you'll start with the needle tip at a 90-degree angle, approximately 5 millimeters from the edge of the skin wound, and you just rotate that wrist through. Bring in the needle tip through the wound and then rotate it further through. And reload that needle about 2/3 the way back. You want to enter the side of the wound closest to you at the same depth that you exited the initial pass or far pass, and rotate that wrist through, exiting approximately 5 millimeters from the skin edge. And we'll pull that through, leaving about 1.5 centimeters to 1 centimeter tail. I'll always hold the tip or the end of the suture to keep it from pulling through. And we'll 2 throws forward over our needle driver. We'll grab the tip of our suture and we'll pull that through. Now, to keep that pulled down, we'll bring the free limb to the same side as the needle in, and that'll keep it locked so we can reverse throw and tighten that down, and that locks that suture knot. And then one more forward throw. And generally for a 4/0 braided silk suture like I'm using, 3 throws is plenty to keep that knot down. So now we'll cut. It's about 1 centimeter tail. For the remainder of the closure, now that we have the center closed, we'll start dividing the wound in half. So 5 millimeters from the skin edge, rotate that through, out of the wound. Now, if you want to leave this needle in the skin to help reload, you can pull it about 2/3 the way through, grab it with your needle driver, and then you're already set for your next pass with the needle. So entering at the same depth that you exited, rotate through, pull the suture through, 1 centimeter to 1.5 centimeter tail, 2 forward throws around your needle driver, grab the tip of your suture, pull down. It's nice and tight but not overly tight. We'll pull the free limb to the opposite side, and then reverse around our needle driver to lock that knot down. And then a final forward throw. And we can cut our tails. And again, dividing the remaining length of the wound by half. 2 forward throws, one reverse, and then a final forward. And with the remaining free spaces, we'll divide each of those in half to finish our closure. So I'll start on one end and work my way to the opposite. Once the skin edges are fairly well approximated, it can be much easier to pass the needle entirely through, which can save a bit of time. All right. So now that we have all of our sutures in, for aesthetics purposes, I'll always pull the knots to the same side. And you can check your spacing using the end of your forceps. If there's a distance between the sutures that's wider than the end of the forceps, it's likely that you'll need another suture. But these are within that range. So now that we've got them in, how do you take them out properly? So you want to remove the suture while not dragging any of the exposed suture through the skin, therefore increasing the risk of infection. So grabbing your knot, you'll pull up gently, cut right at the surface of the skin. That way you're not pulling any exposed suture through, and just pull it out. And you do each subsequent one the same exact way. And that was our simple interrupted suture techniques with removal.